Tanisha Moyer?
Yes.
Hi, I'm Deb Sanders.
Hi, Deb.
Hi.
Is it okay?
It is okay. Is Tanisha okay?
Yes.
Good. I go by she, her. And you?
I also go by she, her.
Good. I'd like to address you most appropriate for you.
I appreciate you.
Thank you. I'm going to do a little hand hygiene here before we start your physical assessment.
Okay.
Okay. Going to briefly go through the systems: head, ear, eyes, nose, throat, chest, and cardiac. Okay?
Okay.
All right, I'm just going to start with a general survey. You seem to be comfortable, calm, not under stress. Breathing seems regular.
Mm-hmm.
Okay. Do you have any complaints today?
Not today.
Okay, good, good. No pain or discomfort anywhere?
No.
Okay, good. I'm going to start with a brief, if you can, just come a little closer to the edge.
Okay.
I'm going to start with a brief inspection of your head, and then I'm going to palpate your scalp.
Okay. I have to tell you I use temporary hair dye, so don't be alarmed if your hands turn purple.
Okay, thank you for letting me know.
Okay.
All right, I see that your hair distribution seems even, and I'm just going to palpate the scalp for any lumps, bumps. Doesn't appear to be any lesions. Feel your occiput. Okay. I'm going to palpate your temporal pulse. Okay. Now I am going to do a brief whisper test, we call, to assess for hearing. So I'm going to sit beside you on each side. I'm going to ask that you occlude your ear that I'm not going to test in, which is your left ear first.
Occlude, hold it down.
Yes, I'm sorry. Hold down your ear. Yes. And I'm going to sit right behind you. And I'm going to whisper a series of 3 letters and numbers, and I just need you to repeat them.
K-2-4.
Very good. Okay, you can let go of your left ear. I'm now going to do your left ear assessment. So occlude your right ear.
Okay. B3.
Very good, thank you. Okay, so your hearing is intact.
Yay.
I'm now going to test for your pupillary response and what we call the extraocular movements. So first I'm going to check for your response to the light. I'm going to flash the light. Just look straight ahead for me. Okay, so direct and consensual response is there. I'm also going to do it on the other side. Okay, all right. Pupils are regular, round, equal, and reactive to light. I'm now going to check your cardinal, they're called the 6 cardinal eye movements. Okay, so look at my finger and just follow it. Extraocular movements are intact, which demonstrates that the cranial nerves 3, 4, and 6 are intact. Okay, I'm next going to assess your oral cavity or your mouth. So open up.
Say ah.
Yes, say ah.
Ah.
Okay, wow. I need my pen light. Sorry, excuse me. It's a little dark in here too. Okay. So I see her uvula is midline, which demonstrates cranial nerves 9 and 10 are intact. Stick your tongue out, and cranial nerve 12 is intact. I'm now going to take a look in her mucosa. Pink, no lesions, no redness. Okay, no swelling. All right, thank you. I'm now going to palpate your lymph nodes just to make sure that there is no swelling, no tenderness, or they should be supple and soft. Okay. So I'm going to start with your preauricular, your tonsillar, your submandibular, your submental, your deep cervical. And if you can do me a favor and kind of hunch your shoulders, that allows me to palpate your supraclavicular. And I don't feel any masses. And we'll end with your occipital and your posterior auricular. Okay, good. I'm not feeling any masses, any swelling, and that nothing was tender? Okay, good. Okay, now I'm going to assess your trachea and your thyroid. So I'm going to grab here in your throat softly. Now, I can feel that your trachea is not swollen. I'm able to deviate it slightly. And I'm going to go just below the cricoid angle and palpate your thyroid. Intact, no swelling. Okay, thank you. Okay, I am now going to palpate and listen to your carotid arteries. So first I'm going to feel for any thrill, and then I'm going to listen. Palpate. And listen. Okay, no worry in either artery. Okay. And I'm just going to assess. If you can do me a favor and tilt your head forward, back, to the right, to the left. No soreness. Can you hunch your shoulders? Bring them down. Awesome. Thank you. Okay. Now I'm going to begin my assessment of your lungs. I'm going to begin with your posterior breath sounds, or the back of your lungs. So I'll sit at your side here and just ask you, just going to ask you to take slow, deep breaths. In through your nose, out through your mouth. Okay, I'm now going to come to your right mid-lobe. So sorry, I'll have to come right here by your breast tissue. Very good. And again. Good. Breath sounds are clear, no rails, no crackles, no wheezing. I'm kind of hot too. Deep breath. Again. Again. Okay. Okay, in your left lower lobe, I'm going to assess for what we call egophony. So I'm going to ask you to say E while I'm got my stethoscope on your left lobe.
Tell me when.
Again. Again. Very good. So there's no egophony. I'm now going to listen to your interior breath sounds. I'm going to start high in what we call the apex of your lung. Deep breath. Okay, very good. Lung sounds are clear, no rales, no crackles, no rhonchi, and no wheezing. All right. Now I'm going to listen to your cardiac sounds. I'm going to start at the what we call the base of your heart and work my way down. It's kind of like a Z pattern I'm going to follow.
Okay.
And I may have to go around some breast tissue, and I might have to go underneath your t-shirt just to let you know. Okay?
Thank you.
So I'm going to start with the aortic. You could breathe normally.
Okay.
Pulmonic. Tricuspid. Oh, that's one I gotta go down here, I'm sorry.
Nope, you're fine. Thanks for letting me know.
Okay. And now I'm gonna go mitral. Excuse me.
Let me hold it.
This is fine. I'm going to lift up the end tip of your bra here. Oops, gotta go up a little higher. Sorry, dear.
You're all right.
I mean, Tanisha. And now I'm going to go to the PMI a little bit further over. Okay. S1, S2 sounds. Heart rate is regular. Okay, now I'm going to ask you to lay on your side.
Can I take a sip of my water?
Of course,
Thank
of course.
you. I'm a little dehydrated.
Sure.
My friend tells me I don't drink enough water, so I'm trying to do better.
Always drink more water. That's what I'm told too. Okay?
Like this?
Yes. I'm now going to listen with the bell of my stethoscope.
Okay.
I just listened with the diaphragm.
Oh.
Okay. And this is for murmurs. So aortic. No murmur detected. Pulmonic. Excuse me. Sorry here.
You're all right. There's a lot of breast tissue.
I understand. Okay. And now I'm going to go below and listen. Mitral. And I'm going to have you sit up. Here, I'll help you.
Thank you.
You're welcome.
Oh, thank you.
Come to the edge. And if you can lean forward a little,
Okay.
take a deep breath. Exhale. And hold it. I'm going to come under and listen for any evidence. Okay, no murmur. Thank you. Okay, now one more position. I'm going to ask you to lay up against this pillow.
Okay.
Put your feet up and lay back. That's 30-degree angle. And I'm looking for any evidence of jugular venous distension, which there is none. Thank you so much. And that concludes our assessment. I will also say that in observing your skin, I did not note any lesions. Thank you.